What is tinea infection? How did I get it? Why does it recur again and again, even after completing the full course of treatment? Is there anything wrong in my blood? Do I need to get any blood tests? How can I get rid of it completely and permanently? These are the routinely asked questions in our OPD. Hello everyone, I'm Dr. Ajay Goyal, Consultant Dermatologist and Founder Director at Vuederma Skin Laser and Hair Clinic, Panchkula. Today, I'll be talking on the fungal infections of the skin. Fungal infection has created a menace in our society. Every other household is harboring this fungal infection, and even after completing the full course of treatment and taking full precautions, it is coming back again and again. Therefore, I've divided my talk into two halves. In the first half, I'll be talking mainly on the ways to prevent fungal infection from happening in the first place. As we say, prevention is better than the cure. In the next half, I'll be highlighting few points which can prevent its recurrences. Before I begin, I would like to tell you that I'll be taking your questions at the end of my talk. So please don't hesitate to write your questions in the comment section below. Tinea is basically a superficial fungal infection of the skin. It is known by various other names such as ringworms, daat khujli, or dinai. It usually presents with severe itching and skin rashes. The skin rashes of tinea infection, they are very typical. They are circular red areas which can look like rings or multiple rings. The rings can be open or closed. Therefore, the name ringworms. Any body site can be affected, but especially the areas around the groins, below the breasts, and under the armpits, they are usually most commonly affected. They can also affect your hair and nails. What are the causes of fungal infection? Tinea infection. Tinea infection is usually occurs due to excessive sweat and moisture. Excessive moisture can either be due to if you are wearing tight-fitting clothes like jeans, jeggings, or leggings, or excessive moisture can also be if you have the habit of not drying your body completely after taking bath. Other contributing factors for tinea infection are abuse of steroids, other family members being affected. So once the tinea infection occurs in one family members, it can spread rapidly from one person to the other. Spread can happen either by direct-to-direct skin contact or sharing of personal use items like your towel, your handkerchiefs, your beddings, combs, or shoes and slippers. So what do you do once you develop a fungal infection? Usually what patients do is they'll go to the nearby chemist and they'll take the over-the-counter medicines. They're usually betnoate, quadridum, fordum, lobate GM, betnoate GM. So basically these medicines, they're a cocktail of antifungals, antibacterials, and steroids. So these will they will make your skin better for a while, but as long as the effect of the steroids wears off, you'll develop this fungal infection again and again. And once we use these medicines repeatedly, then they'll make your skin very thin. You'll develop stretch marks, and then the infection will come again and again. So once we develop this fungal infection, then we need to visit a dermatologist and take the treatment under his full guidance and constant supervision. As per the fungal infection, he'll advise you some antifungal creams and lotions, and they need to be taken properly. And the full course of the treatment need to be taken. That usually lasts from 2 to 3 months. While applying the antifungal cream and the lotions, we should take care that they should be applied on the entire affected area plus 2 centimeters around the normal skin. This is called as 2 centimeter rule, and this is very important to prevent its recurrence. While taking bath, we should make sure the water is cold or lukewarm. We should not use hot water, as hot water can irritate your skin and make the itching worse. Also, make sure you're not using any soaps or any Dettol or Savlon kind of antiseptics. All the clothes, they should be washed in a hot water, and either they can be dried out in the sun or you should iron them properly. Make sure you're using a loose fitting clothes. Try to avoid tight fitting clothes like jeans, jeggings and leggings. Also make sure your entire affected family members and your close contacts, they are treated simultaneously. If your close contacts are left out or if they are not treated properly, then you can develop this fungal infection again. Make sure there is no sharing of any personal items like your towels, soaps and any other personal items that can cause fungal infection. Thank you. Now I'll be taking your questions. Right now I can see there are no questions. Skin discoloration. Skin reduction is a different topic, so we'll be taking it on our next talk. I'm waiting for a few questions if I can have. Well, there are no questions so far. So I think we'll be ending this talk for now. Thank you so much for attending.